right, in addition to employer-based coverage, would you like the option to purchase a private plan through an insurance exchange or a public plan like TennCare, Tim?
Well, I think the simple answer to that would be yes. The reason this question came up, really, I don't know what the right word is. I'll just tell how the issue came up for me. When Madeline first got sick, and after our first hospitalization, and we got the bill from Bonheur, I was like, wow, that's a lot of money. We do have good insurance. But like I said before, most people, if you're on insurance, you're a relatively healthy person. Maybe later in life you might be hospitalized one time. If you're on private insurance, even good insurance, all of those insurance companies have a lifetime cap. That's something I'd never thought about before. A lot of them, our particular insurance is $1 million. Most people would never meet $1 million. But when you have a chronically ill child that's hospitalized, you start thinking, $150,000, $200,000 for this particular stay. And you can understand how very quickly that could add up. Michelle and I were talking about just, Madeline does not have the type of nursing care and other things that Jenny has, but it's very expensive. And as I was doing some research on the internet, I came across a story of a family that was very similar to ours. I think it was Las Vegas. The husband was a lieutenant on the police department there, so making a very good income, but by no means wealthy, and the spouse stayed at home with their child, who actually had some similar problems with Madeline's. Well, because of their income level, they did not qualify for the Medicaid or Medicare program in Nevada. But because of their child's chronic illnesses, they met the cap on the city's insurance. Mm-hmm. So after they met the cap, they were essentially uninsured. They couldn't be uninsured through the state program. They had met the cap on the private program. So, that's a very small population of people that will ever be affected by that. But it is, part of this whole big issue that we're dealing with is how to ensure that we keep children covered and getting the health care that they need. This brings in issues about what happens when your child goes off of your insurance. Mm-hmm. I think Madeline can stay on until she's 22 or 23, as long as she's a full-time student. What happens after that? And it's obvious she's going to have a pre-existing condition. So, if there was some kind of scheme or something so that people could move from their private insurance to a public payment option, and we were talking about this before. I actually called TennCare and asked, what would happen if we met the cap? And I was given the very family, if I'm being facetious here, family-friendly advice that, well, since your wife doesn't work, you guys could just get divorced, and then your wife would not go to work. She'd be considered indigent, and then you could get your daughter on TennCare. That's not a very good solution. I don't think anybody would agree with that. And I think highlights how complicated this issue is, and how we have to come up with the system, and how maybe the things that we've been doing in the past are not the best solutions for what families are facing.
We were given similar advice. My husband and I both work. Fortunately, I'm able to work. I'm a teacher. I have a decent income. My husband runs a really huge printing press. He makes a decent income, but we do not qualify for TennCare because of that. I have somebody that comes out to the house that tells me they have to come out to the house every 6 months to meet Jacob from Department of Human Services or whatever, and she keeps telling me, oh, you're not in crisis yet. Well, really, what's crisis? I mean, what do we have to do? We have to be declaring bankruptcy to be in crisis? Does my husband have to leave us to be in crisis? But even then, on my salary alone as a teacher, we don't meet the income eligibility for TennCare, and that kind of scares me. Now, because Jacob will never lead an independent life as Madeline will and Anna will, he will qualify for SSI and TennCare when he turns 18, after we go through the court system to have him declared mentally incompetent. We have to do that. That's a whole other issue. So there are some big issues that need to be looked at, and like Tim, I'm not smart enough to have all the answers, but I'm hoping we can come up with some.